A very warm welcome to all of you from us at UMCC Medical Consultant Connectors. It is an absolute pleasure to have you join our community today, a space dedicated entirely to your health and well-being. We believe knowledge is power, especially when it comes to understanding our own bodies. Our mission: break down complex medical topics into clear, actionable information. We want you to feel empowered, not overwhelmed. Health is not just the absence of disease. It is complete physical well-being, mental well-being, social well-being. Taking a moment to learn is a profound act of self-care. In our fast-paced world, it can be easy to put our health on the back burner. We often prioritize deadlines, chores, the needs of others before our own. Investing in your health is the single most important investment you can make. Think of it as building a strong foundation for a house. Without it, everything else could crumble. Today, as we mark October 6, 2025, we take a deep dive into a topic that touches millions: breast cancer. So, what exactly is breast cancer? Let's break it down in simple terms. Our bodies are made up of trillions of tiny building blocks called cells. Normally, these cells grow and divide in a controlled, orderly way to keep our bodies healthy. Breast cancer occurs when cells in the breast tissue begin to grow out of control. Instead of dying off as they should, these abnormal cells continue to multiply, forming a lump or a mass of tissue called a tumor. Not all breast lumps are cancerous. Some are benign, not cancerous, and do not spread. Malignant tumors are cancerous and can invade nearby tissues. They can also spread to other parts of the body. This is called metastasis. That's why early detection is so crucial. When breast cancer is caught before it spreads, treatment is often more successful. The uncontrolled growth disrupts normal breast function and, if unchecked, can impact the whole body. It starts small at a cellular level but can have a profound impact. It's not a foreign invader. It's our own cells that stop following normal growth rules. Breast cancer is not a single disease. It's a complex group of diseases. Doctors classify them by where the cancer begins and whether it has spread. The most common types start in the ducts, the tubes that carry milk to the nipple. The most common types also start in the lobules, the glands that produce milk. One common form is ductal carcinoma in situ, or DCIS. DCIS is non-invasive. Abnormal cells are in the lining of a duct but haven't spread outside it. DCIS is the earliest stage and is highly treatable. Another major type is invasive ductal carcinoma, or IDC, the most common overall. In IDC, cancer cells break through the duct wall and invade surrounding breast tissue. From there, they can spread through the bloodstream or the lymphatic system. Similarly, invasive lobular carcinoma, or ILC, starts in the milk-producing lobules and can also spread. Knowing the specific type helps doctors choose the most effective treatment plan. One of the most common questions people ask is, what causes breast cancer? The straightforward answer is that there is no single cause. It results from a complex mix of our genetics, our lifestyle, our environment. Certain risk factors can increase a person's chance of developing the disease. Having a risk factor, or even several, does not mean you will definitely get breast cancer. It simply means your risk is higher than average. Some factors we cannot change, for example, being a woman. Another unchangeable factor is aging. Risk increases with age, with most cases after 50. Personal and family health history also plays a significant role. If you've had breast cancer in one breast, your risk is higher in the other. If your mother's sister-daughter had breast cancer, especially young, your risk is elevated. Inherited genetic mutations can greatly increase risk. BRCA1, BRCA2. These are part of your biological makeup and beyond your control. There are also lifestyle-linked risk factors we can influence. Being overweight or obese, especially after menopause, fat tissue can produce estrogen. Lack of physical activity, regular exercise lowers risk. Drinking alcohol increases risk. The more alcohol you drink, the greater your risk. Certain hormone replacement therapies during menopause can add risk. Knowing common signs and symptoms is a powerful tool for early detection. The most well-known sign is a new lump or mass in the breast or armpit. It may be painless, hard, have irregular edges, or be soft and rounded. Swelling of all or part of a breast, even without a lump. Skin dimpling, like orange peel breast or nipple pain. Nipple retraction, nipple turns inward. Redness, scaliness, thickening of the nipple or breast skin. Any nipple discharge other than breast milk is a warning sign to get checked out. If you or your doctor finds a potential sign of breast cancer, The next step is a thorough diagnostic process to get a clear picture of what is happening. This journey to clarity usually begins with a clinical breast exam performed by a healthcare professional. Following that, imaging tests are typically the next step. A mammogram, a special X-ray of the breast, is one of the most common screening and diagnostic tools. Compassionate doctor explaining a mammogram result to a patient in a calm clinic. If the mammogram shows an area of concern, a doctor may order a breast ultrasound. Ultrasound uses sound waves to create a picture of the tissues deep inside the breast. Ultrasound can help determine if a lump is a solid mass or a fluid-filled cyst. For a more detailed look, a breast MRI may be used. MRI uses magnets and radio waves to create highly detailed images of breast tissue. MRI is often used for women at high risk or to get more information about a suspicious area found on a mammogram or ultrasound. The only way to know for sure if a suspicious area is cancer is a biopsy. During a biopsy, a doctor removes a small sample of tissue from the concerning area. That tissue is sent to a lab where a pathologist examines it under a microscope for cancer cells. If a diagnosis is confirmed, a team of doctors will create a personalized treatment plan. Main treatment options include surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy. Surgery is often a primary treatment. Lumpectomy, removing the tumor plus a small margin of tissue. Mastectomy, removing the entire breast. Choice depends on size and stage of cancer and patient preference. Many women who have a mastectomy also choose breast reconstruction. Other treatments are often used with surgery. Radiation therapy uses high-energy rays to kill remaining cancer cells after surgery. Chemotherapy uses powerful drugs, IV or pills, to kill cancer cells throughout the body. Chemo is often used for cancers that have spread or are at high risk of spreading. Hormone therapy works for cancers sensitive to hormones like estrogen. These drugs block hormones from reaching the cancer cells. Targeted therapy attacks specific weaknesses in cancer cells, often with fewer side effects. Treatment is highly individualized for the best outcome. While there is no guaranteed way to prevent breast cancer, you can take proactive steps to lower your risk. Living a healthy lifestyle is your first line of defense. Strive to maintain a healthy weight through a balanced diet and regular physical activity. Aim for at least 150 minutes of moderate intensity exercise, like brisk walking, each week. Eating a diet rich in fruits, vegetables, and whole grains while limiting processed foods, red meat, and sugar can make a significant difference. It is also very important to limit your alcohol consumption. Even small amounts of alcohol can increase your risk, so the less you drink, the better. Breastfeeding, if you are able to, can also play a role in lowering breast cancer risk. The longer you breastfeed, the greater the protective effect appears to be. It is also wise to be cautious about exposure to radiation and environmental pollution. For women considering hormone replacement therapy to manage menopausal symptoms, it is crucial to have a detailed discussion with your doctor about the potential risks and benefits. If you have a strong family history of breast cancer, you might consider genetic counseling to see if you carry the BRCA1 or BRCA2 gene mutations, which would allow for more intensive screening. Familiarizing yourself with the key investigations and tests is also part of taking control. Regular screening is essential for early detection. For many women, this includes yearly mammograms, typically starting at age 40, though recommendations can vary. A clinical breast exam, performed by a doctor or nurse, should be part of your regular checkup. And don't underestimate the power of breast self-awareness. This means being familiar with how your breasts normally look and feel, so you can report any changes to your healthcare provider right away. Other important tests, should a concern arise, include ultrasound, MRI, and ultimately, a biopsy to confirm a diagnosis. Your engagement is what brings our community to life and spreads this vital information far and wide. We sincerely hope this guide has been informative and empowering for you. If you found this helpful, please consider giving it a like to let us know. To stay connected and receive more health insights from UMCC Medical Consultant Connectors, be sure to subscribe to our channel. Most importantly, share this article with your friends, family, and social networks. Call to action graphic with like, subscribe, share icons, and UMCC logo. You never know whose life you might touch by sharing this knowledge. Thank you for taking the time to prioritize your health with us today. Our goal is awareness, not fear, to encourage proactive steps. Understanding is the first step toward prevention and effective management. We are here to walk that path with you. This guide is your trusted companion. We will explore what breast cancer is, who is at risk, what signs to look for, how it's diagnosed, effective treatments. Medical science has made incredible strides. The outlook is more hopeful than ever for many. Information can be a lifeline. It provides clarity in uncertainty and guides you to the right questions for your healthcare provider.